Have you ever wondered what it would be like to practice dentistry in another country? Maybe just for the sake of interest, or perhaps because you're considering a sea change? Then this is the podcast series for you. Listen in while we ask key clinicians from our main dental protection jurisdictions about their dental practice experience and ponder the unique challenges and opportunities experienced by dental practitioners in their part of the world. My name's Dr. Annalene Weston, dental legal consultant with Dental Protection based in the Brisbane office. And welcome to What's It Like to Practice as a Dentist in Ireland. And today I am absolutely thrilled to be joined by Dr. Jennifer Collins. Hello, Jennifer.
Hello.
Thank you so much for taking the time. So I wanted to start off by reading your bio for colleagues who haven't met you. So please just bear with me. So Dr. Jennifer Collins is a general dentist based in Dublin, Ireland. Her clinical focus is restorative and cosmetic dentistry delivered within a specialist practice setting. She's previously been a committee member of the Irish Faculty of Primary Dental Care and the Irish Dental Association, and she continues to engage in regular dental meetings and ongoing professional development. Dr. Collins has been the clinical director of the Dental Care Ireland Group, which is the largest dental corporate in Ireland for the past 5 years. This role involves supporting and coaching dentists, compliance, recruitment, and the development and delivery of the group's education and CPD programs. So, would it be okay if you just start off by telling us a little bit about your background? Obviously, we have your CV there, but why you chose dentistry in the first instance. And of course, you and I went to the same university, and for neither of us was it our country of origin. So how did you end up there too?
So I qualified in Cardiff in 2004, and at the time, a lot of Irish people were traveling to the UK to study. There was such limited places in Ireland for dentistry. We still do, whereas now Irish students will often go to more exotic places like Spain and these countries. Uh,
Really?
yeah, that's right. Yeah. Whereas at the time we all ventured to the UK, not too far from home, but far enough at the same time. So I grew up on a farm in Cork in Ireland. And my dad's a farmer and my mother is a doctor. And she only retired a few months ago at 75. So she always, when I was growing up, I always was interested in healthcare and the sciences. And I saw myself as a doctor and I really was interested in studying medicine. And my mother guided me towards dentistry because she thought as a woman, it'd be a very good career choice.
Yeah,
She
for
thought the
sure.
hours would be better. And later on in my career, when I did do a hospital job, I understood what she meant because with dentistry, for the most part, there's no on calls, there's no awkward hours in lots of practices. And I thought, that sounded good to me at that age, but I was only 17. I didn't really know what I was doing in hindsight, but I'm really glad I chose dentistry and it's been a fantastic career choice for me and I've absolutely no regrets. So I went off at 17, took the ferry to Wales with my mother and my sister and did my 6-year undergraduate diploma. It was 6 years coming from Ireland because we had to do a pre-dent year.
I had to do 6 years as well with the Irish students. Mine was for a different reason though. I didn't have chemistry A level, so I had to do the 6 years. So I went in a couple of years before you, but with the Irish students in that preclinical. So yeah.
Yeah, it was great. I must say it was a fantastic education I got. I mean, at the time in Wales, I'm sure you'll recall, there was a lot of caries and a lot of issues with dentistry in Wales. And I must say, I got so much experience treating caries, extractions,
For sure.
copious amounts of dentures, lots and lots of
Yeah.
dentures. But I came out with a really good education, and that really stood to me later on in my career. So when I left Cardiff, then again you'd have done vocational training also, which was
I
the year
did. Where did you do yours?
where I did it in Brighton.
Wow, really?
Yeah,
That's really cool. Did you get to see Fat Boy Slim play on the beach?
I did. Yeah,
Brilliant. You see, I picked that because we're we're the same ilk.
yeah, brilliant. I had a great time down there. I did lots of messing and gallivanting, but I did do a bit of dentistry on the side. I
Probably
managed
for
to
the
complete the
best.
year. Yes, yeah. So I had a great year down there, and also Brighton was home of the hen parties and the stags, so I got lots of experience with different facial traumas, etc. But I did go on to doing 2 years in Brighton and Eastbourne, in the hospital in Brighton and in the District General in Eastbourne, where I did maxillofacial surgery for 2 years.
That's
And that was
cool.
fantastic. Yeah, it was amazing because you really got to see what it was like in a hospital setting and environment. And it was, I mean, working night shifts on calls at the weekends, traversing the countryside, going to different hospitals at a young age was a massive learning curve for me. And I grew up fast because I had to think on my feet and I had to get good quickly. And often there's no one else in the hospitals at night time in these departments, and you had
Yeah,
to
for
do all
sure.
the facial lacerations on your own. So you got good. And again, it really stood to me later on in my career. So I'm really glad I did those couple of years, even though they were difficult at the time.
Yeah, it always shocks my Australian colleagues. So when I talk about how different things were going through the system in the UK, in Wales, so the fact that we had to do so many extractions before we were allowed to sit our finals. So we were very competent by the time we got there because you had to actually get the whole tooth out, not just some of it to be signed off. And also the fact that when people did the house jobs, they were working in the emergency department. So whether you call it casualty or your emergency room, whatever the name you have, the fact that they have dental practitioners who are rostered to be there to deal with the facial lacerations. And of course, as you've rightly said, a lot of glassings, although all the glass got changed to plastic, didn't it? Which hopefully has made a difference for that.
Yes. Yeah. Yeah. Exactly. Yeah.
Yeah.
But I think you can't beat the hands-on experience. You have to really learn on the job sometimes in dentistry. And what I found was because you had more senior dentists and doctors in the background helping and supporting you and guiding you, you learned from the best. And so you learned fast and you got good. And actually, it was an amazing experience because now in my career, any extraction I come across, I can always handle. And I don't generally rush into doing surgical extractions. But if an extraction becomes surgical, I know how to manage it. I know how to do the treatment. I know how to manage any issues that come along. Suturing, all that is so, second nature to me because I do so much of it in those couple of years.
We were really lucky, I have to say. When I first came to Australia, I was working for the school dental service and in Victoria. And just to give you an idea, you can fit the UK and Victoria 5 times. And my wedge was a third of Victoria. So I used to have to fly places and drive long distances. And I was the only dentist. I had 13 dental therapists that worked with me. And I took out a lot of hypermineralized sixes. And so the surgical competency that we gained was an absolute lifesaver for exactly the reason that you're saying, being able to get teeth out and being able to put people back together again. We were very blessed, I think. We were very blessed. So you mentioned working for a corporate now.
Yes.
I'm really curious. So you still have clinical contact?
Yes. So I work 3 days a week doing clinical dentistry. So what I did first, I actually went to Australia as well, Annalene. I got a visa to work in Australia and went out for 6 months. I went to Perth and I went to the East Coast. So I spent my youth watching Home and Away, and I went on a hunt for Alpha in Yabby Creek, and I travelled down to Sydney. Didn't find Alpha or Sally, but I had an amazing experience. So I had the visa to work in Australia. Really enjoyed my time there. It felt very far from home. I mean, I'm sure you feel that at times that everything was the same but a bit different. And I had been away from Ireland 9 years at that stage. So I figured, as my mother said, I had to stop rolling and I had to I had to settle down a little bit and lay down my roots. And I felt that was Ireland is where I wanted to settle. So I went back to Ireland and started working in private practice. I'd intended to specialise, but I was in a really good private practice in Dublin in a very affluent area when that big global recession hit in 2007, 2008. And I figured best stay where I am and best just,
For
really
sure.
upscale. That's it, diversify my skill set, get really good at the root canals, get really good at the fillings. I spent a lot more time communicating and treatment planning with patients at the time because I had the time. And I figured maybe I should park the specialisation for now and just stick with private practice. So that's what I did. And I stayed in a practice for about 10 years. Attempted to purchase the practice that didn't work out. But when a door closes, another door opens. And
Always.
then I found myself in Dental Care Ireland, which has been an amazing experience from the get-go. That was about 7 years ago now. And I joined a specialist practice again in a very affluent area of the city. I was the first general dentist, so it was a bit daunting at times. I didn't know what to expect, but at the same time, I love a challenge. So I embraced it and ran with it. And then COVID hit a few months after I joined. So, well, actually, COVID hit maybe a year after I joined. And then at the time, we had no dental representative in Dental Care Ireland. So, or sorry, dentist representative. So I became the clinical director of the group. Again, biggest corporate in Ireland at the time was about 14, 15 practices. Now it's 37. So by
Okay.
Australian standards, it's probably still a small group, but in Ireland, it's a big group. And it's been a fantastic role, which I have relished from the first day.
That's fantastic. So I'm curious, you mentioned about it being about 37 practices now. So corporate dentistry, is that a big part of dental service in Ireland currently, or is it still in its fledgling, still in its infancy, do you think?
It's still evolving. So it's definitely a space that's growing month by month, year by year. So we have several groups now, dental practices. We have smaller groups, maybe that might have 3, 4, 5 practices, and we have two or three bigger groups who would have an excess of 20 practices. But it's a fairly new area in dentistry in Ireland. Corporates really are doing well. We're doing things right, if you know what I mean. We're doing things by the
Yeah, yeah.
book. We're very engaged in terms of compliance and CPD and education. And a lot of what we do as a group is empowering dentists to do the best dentistry they can, really. And so for a lot of older retiring dentists, they found that merging with Dental Care Ireland and selling the practice to a dental corporate has been the best bet for them in terms of retiring from the practice and making sure their patients are looked after they exit the practice.
That's heartening. I actually work for a corporate. I do still practice, although I'm not going to lie, it's not often. It's a couple of days a month. I actually practice on Sundays because I work full time for dental protection. And of course, between that and being a full time taxi driver, and because I have teenage boys, so I spend a lot of time at sport. But one of the reasons I love working for a corporate is because in Australia, every registrant is equally as responsible for that practice meeting the standards. So that's like your infection control standards, for example. And so if there's a breach, every single registered practitioner is held equally as accountable. Okay. So when you work for a corporate, generally they are they have people whose whole purpose is to make sure that everyone's compliant. So it
Yes.
doesn't negate your responsibility, but it's really nice to have that extra layer of knowing that there are people whose we have infection control champions and their sole purpose is to ensure that the infection control standards are being met because the corporate can't risk any reputational damage of that nature. And it's just something I really value. I just feel like there's that additional level of safety because I can't control what happens when I'm not there,
Yes.
but
Yes.
I'm still liable for it. Is it the same in Ireland that you're liable if for anything that happens in practice, like an infection control breach, or is it the practitioners whose hands are in the mouth who's liable?
Well, we would all have a responsibility towards ensuring that we are compliant and that infection control protocols and policies are being upheld. But the practice would have a responsibility as well. So we would have a compliance team also, and we have practice managers and all sorts of people in place in every practice to ensure that things are done properly, if you know what I mean. So, but it is a lot. It's a lot for a lot of dentists to oversee all that. So that's why a corporate can come in handy there because they have the
Really?
people and the manpower in the background. And so, we're all busy people, we're all professionals, and often we have very busy family lives. So to be able to come into work and know everything is set for you, that is, I find, gives me great peace of mind. I go to bed every night with a clear conscience, knowing that I've done the best work I can in the safest possible environment, and I've done everything right from a compliance point of view. So that's kind of what I
Yeah.
feel like working in a corporate has done for me.
Yeah, that's really valuable, actually. And it's a really important message that you've given there. Thank you. So I'm curious, we've got private practice in Ireland. What about the public system? Is there much in the way of free treatment for people? And if so, who's it for?
So we do have a state-funded scheme. We call it the medical card scheme. So we have a cohort of the population who are entitled to dental and medical treatment under their medical card. So a lot of people who would hold a medical card would arguably be the most vulnerable in society. So they would
Yeah.
often be people with disabilities or long-term illnesses or chronic illnesses, people who are unemployed or the elderly. So again, our state funded scheme isn't really resourced adequately. So a lot of dentists who participate in the scheme often complain about the remuneration. So really a patient who holds a medical card is only entitled to an examination and a clean once a year and 2 fillings a year and unlimited extractions. So it's very limited. It's still an important service, and people who need the treatment and can't afford private treatment are very grateful for the service. But a lot of dentists don't participate in the medical card scheme. It's voluntary. So say we would have probably about 2,500 dentists in Ireland, maybe 2,700 dentists working. There's only about 600 dentists who participate in the medical card scheme. And often it's geographic. So in city centres where the cost of running practices are very high, they would often not participate in the scheme, whereas often more rural practices where presumably the rent is a bit cheaper and the overheads cost less, they would often be people who participate. So it's definitely a scheme that could do with being approved, and the Irish Dental Association are constantly advocating on behalf of dentists regarding it. But I guess watch this space. There's no system perfect, and at least we have a system, but I think it should be resourced better.
Yeah, not as resourced as well as it could be. That's really interesting. Thank you. So the majority of our dentistry is being provided through private practice. Do you have like a fee per item system, or do you have dental insurance? You might recall from working in Australia, we all have many people have private insurance. And so, and that will copay. You pay your insurer an amount and then it copays towards your dental treatment within certain limits and fund rules. What is it like that in Ireland, or is it just simply fee for item?
It's changing. First of all, I'd say it's changing. So first of all, we have a scheme called the PRSI scheme. So 80% of Irish
Yes.
adults are entitled to a subsidised dental examination and a subsidised dental cleaning a year, which is great to draw in patients who may be a bit apprehensive about the costs of dentistry in Ireland. But for the most part, we're private, and dental insurances are becoming more popular. So we have 2 or 3 different insurance schemes who will co-pay. Again, something similar to Australia, they might cover 2 examinations, 2 cleans a year, and maybe, depending on the scheme, 50 to 70% of the filling cost or crown cost, etc. But lots of people still pay privately for dentistry.
Yeah, okay. So you've worked in different countries, we've just established. What things do you think are unique to working in Ireland? Is there anything that's particularly unusual or unique that stands out?
So I think in Ireland, I have noticed it's a very relationship based system. So there's a lot of people place a lot of value and trust and continuity in their dentists. They like to see the same dentist. They don't like to hop from one dentist to another within a practice. And I really noticed that in Ireland. Ireland is small, and a dental practice is really a place that is embedded in the community. So I have noticed that people put a lot of trust in you, and they want to see the same dentist all the time. And when they do trust you, really, it's much easier from my point of view because they listen, they understand, you can communicate with them better, and you can guide them as to what treatment is best for them. So I think that's one thing I really noticed is the trust element of patients in Ireland. I think also we have a very strong professional community. So there's a lot of empathy and kindness and support and compassion amongst dentists. So I really love in Ireland that as dentists, we're very friendly with each other. We're very interested in what we're doing, what each other, what we're all doing. We have different groups that we meet up regularly in the area. We have the Irish Dental Association, which has about 1,000 members, I think. I could be wrong on that, but give or take. We have regional meetings every month that we meet up and discuss cases and whatnot. And they're brilliant from even a mental health point of view to discuss what's going on in your day-to-day routine. So I think the fact that we are very close as a profession really is very helpful for us dentists. We're not competitive amongst each other, which I think
That's
is great.
lovely. That's
Well, it,
lovely.
it makes a
And
big
for young
difference because
ones too.
yeah, and you always know that there's someone who can support you or guide you, or you can always be honest with somebody. There's always someone who can help you. And I find having friends in dentistry has been invaluable to me personally. And I say not a day goes by that I don't ask my colleagues at work for advice or hints or tips about a case I'm doing. And that really has helped me progress my dentistry, and it's helped me, kind of take on more complicated cases because I have so many brains helping me with something that I think I can advance towards cases I want to do safely, knowing that I'm doing the right thing by the patient, I'm communicating well, I'm treatment planning properly. And I've had lots of people look at the same case, if you know what I mean. So I always think 3 or 4 brains has to be better than one brain. I hope.
That's fantastic. Those are lovely differences. I love that. That's wonderful. That's probably one of the nicer, more heartwarming answers I've had. So that's great. So I'm curious. You work obviously in Dublin, so you're in a metropolitan area. Do you think that we talked about different funding schemes? Do you think the nature and type of patients that you see and treatments that you do are different to your colleagues based regionally, or do you think it's all same?
I would say with a lot of confidence, it's quite different. So the city centre practices, we would have probably a narrower scope of practices, narrower scope of clinical practice. So we would have a lot of specialists locally. So for example, when I first started out in my career, I did a little bit of everything. I did a lot of endo, a lot of surgery, that kind of thing. Now my own practice is more based on restorative prosthodontic type work, and I would refer endo to my endodontic colleagues. I would refer the surgery to the oral surgeons, etc. And that is often the way it is in city centres. In more rural practices in Ireland, there would be a wider breadth of clinical practice because you don't have the specialist around the corner. So a patient comes in at pain and they need that surgical extraction or they need that endo done, you're going to do it.
You
Uh,
just got to get on with it.
Yes, it's probably a little bit more forgiving, I would think, in rural practices. The standards will still be very high, obviously, but possibly a bit more forgiving. City centres, you need to do it really well the first time, and patients expect high standards, and they get the high standards. So I think that's a big difference I would see. Now, rural Ireland is still, so if there's anyone listening who's considering moving to Ireland and working in a rural practice, rural Ireland is different to rural Australia. You
Yeah.
know, yeah. Like, so to get from one end of the country to the other is probably 7.5, 8 hours. And from kind of east to west is probably about 4 or 5 hours. So you could get to the Midlands and Ireland comfortably in about 2 hours, but still it makes a difference to patients who find it difficult to travel or again, might be elderly or have different disabilities. They would like to really, again, what I was saying previously, dental practices are often really embedded in the community. They don't like traveling and often they just want to be treated by their own dentist. So those dentists would have to do about everything, including pediatric dentistry. So they would be a jack of all trades, you could say.
Oh, that's fantastic. So you mentioned that patients having entitlements, some patients to one free checkup and clean a year, and that some of the people who are using private health would also have something similar. Do you think that this is driving the Irish patients to have more of a preventative approach to dentistry, or are you finding that there are certainly still a lot of urgent or emergency based treatments being provided?
Very good question. I think it helps. I mean, it definitely would help somebody to attend their dentist knowing that they don't have to pay for their exam or their clean is subsidised. But I do think there's still a lot of anxiety and apprehension around going to the dentist. And I'm often surprised when I see a new patient and they still have high rates of caries. And I think, gosh, we're a very educated population and we're very proactive now around our health. So I still get taken aback sometimes why there is still a lot of caries out there. Especially we have fluoride in the water and there's a lot of hype in the media about teeth and oral health and the effect that your oral health has on your overall health. So I think it helps, but I still think we have a long way to go. I do find Irish people have become much more proactive in the last decade about their teeth, especially the younger generation coming up. That stereotype of Irish people and alcohol is almost fallen by the wayside, although we do like a pint of Guinness from time to time. But I do think it's interesting that as a whole, as a nation, that we still have issues with caries and we still have issues with periodontal disease and tooth wear. We're still breaking teeth. We're still not wearing our knife guard. So I guess
Yeah,
people are
we're the
people.
same.
I
I mean, we have a
Yeah.
system, as you know, where people are getting, often, as you've said, two free checkups and cleans a year with their health fund. And yet, I mean, my friend Matt Hopcroft, who does all the research on this, will kick me if I get these stats wrong. But roughly, you have like this third of patients who are like the worried well, and they will attend really regularly and don't need to. And then you have a third of patients who never go. And then you have a third for a whole variety of barriers. And then you have a third of patients sort of somewhere in between. And it's really curious that I don't think it seems to always work out that way. I don't know. So yeah, but certainly often a lot of the people who come regularly don't need to come regularly, but maybe that's because they come regularly. I don't know. I don't
Yeah.
think we'll solve that problem today. It's
No, but it
difficult
is
to know.
interesting because it's often the people who fear the dentist who have the bigger issues when they go to the dentist because they're the ones often who need the emergency extraction or the endo. And then that definitely exacerbates their fear. So it really doesn't help when people don't go to the dentist often. But what I always say to patients is caries, cavities are caused by sugar. And also, if you never brush your teeth and never had any sugar, you wouldn't get a cavity. Okay, you get other problems, like gum disease and periodontal disease, but you wouldn't get a cavity. I think sometimes I kind of break it down to that sugar causes decay and really watch that in your diet. But you know as well as I do, sometimes you're it falls on deaf ears because often there's so much sugar in our diet now, and especially we would have a lot of ultra processed food in our diet in Ireland, despite
Yeah,
the
for
best
sure.
efforts of oral health promotions and policies that are in place. So often there's a lot of hidden sugars. So I see people with caries don't know how they've gotten the cavities, and when we go through the diet to do their dietary analysis sheet, then we kind of are able to understand. Okay, it's that glass of orange juice that's being promoted as a health drink is
Yeah.
actually laden with sugar and acid and causing them a lot of damage.
We have the health star system in Australia on food, and it's really interesting how some of the stuff that will be rated as really healthy, like as you said, orange juice has other issues which surrounding which create other problems, and then other stuff which is considered not to be healthy actually really isn't that bad for you. It's like that whole good fat argument, is it?
Yeah,
Is an avocado
yeah,
bad for you? I don't know.
yeah,
Looks like
yeah.
it might be good to you for me, but what would I know? So we're still seeing a lot of caries, I'm gathering.
It's a lot of caries, a lot of tooth wear. So again, that's one
Okay.
thing. Like, yeah, and it's funny because when you're younger in your career, you're kind of fighting fires a lot, aren't you? You're dealing with the problems that are coming in, and as you get older and you get to know your patients more, I try and look at the forest, not just the tree. So I look at the problem that the patient has, and I try and figure out why they have it, what's going on elsewhere in their mouths, not just diet, what's their brushing technique like, what's their occlusion like. A lot of problems I find are caused by traumatic occlusions. That's been something that I really learned a lot about in the last few years, and it's been very interesting. It's really changed the way I treat patients. I look at tooth wear again, like say I'd often think about how a patient is sleeping. So I might say to a patient, how's your sleep? Are you waking up refreshed? Are you grinding? Are you clenching? And I realized a lot of patients with tooth wear in their posterior teeth and palatal on their upper anterior teeth often have sleep apnea.
They
And
certainly
it's their
do.
diaphragm and nighttime spasming, acid coming up their throat, causing on lots and lots of issues for them. So I wouldn't treat the sleep apnea myself, but I would certainly refer that patient for a sleep study and ensure that they get properly managed. And I find that that really helps. But I think as we develop and evolve in our careers, we see things a bit differently, don't we? And we really want to make sure that our patients long term have good functional and aesthetic teeth. And whatever I can do to ensure that happens, I'm willing to do.
Yeah, no, that's fantastic. Has there been a big drive towards cosmetics in Ireland at the moment? We're seeing Insta perfect smiles popping up, shall we say?
Well, it's massive, massive. So especially with the younger generation, Instagram really is awash with these beautiful white smiles, and you know as well as I do that they're not real, and often they're patients with veneers and crowns and whatnot who've gone to different countries to get the white smile. So I'd have a lot of patients coming in looking for composite bonding, which I would say no to most cases. I say yes to some cases if I think they're
Yeah.
appropriate, but young people coming in with lovely teeth looking for composite bonding because of a bit of overcrowding, I can't justify it. So I will say to patients, composite bonding is not reversible. It's retrievable, but it's not reversible. And once it's on the teeth, it's on the teeth. So I far more prefer a patient to get Invisalign to correct their mild overcrowding and maybe look at permanent incisal edge bonding. At least, there's a circuit breaker there. If it chips or breaks, we can repair it. So massive drive towards aesthetic dentistry. And I think there's a time and a place for it. And I think some people benefit from it, but lots of people don't need it.
Yeah, and they think they do. Do you have the same dental tourism issue that some of my colleagues based in, say, Leeds talk about with people going to Europe to get their cosmetics done? You still have that? You see that in your Irish patients or not really?
I don't really see it in the area I work in, but I do hear of it. I do hear of it in Ireland, patients going over to different countries in Eastern Europe and coming back with very bright white crowns and veneers. And again, I'm sure you see it often at the time they go on fine. It's just the long term management is the challenge. It's the periodontal disease, it's the margins on the crowns and veneers that need to be maintained, just the fractures that develop over time. Those patients are the ones who come into us looking for long term care and management, and it can be a real challenge. But thankfully, I don't see it too often, but it does happen.
Yeah, we have dental tourism issues from Australia also with people going to countries close to Australia and they can get a holiday, whiz bang holiday, and the teeth done for what it would cost for £2. And you can understand the appeal, but exactly as you're saying, it's not without problems. So you mentioned when we started talking two big economic issues that had arisen or moments in time. So I remember obviously the recession of 2007, and I know that Ireland was very heavily affected by that. I was in Australia by then, but I was aware of what was going on because I have friends in Ireland still. And then obviously COVID, which brought with it its own delightful adventure of problems in dental practice. It also brought some really good things too. Look at us communicating like this.
That's right. Yeah, yeah.
Yeah. So, but certainly for dental practice as clinicians, it brought with it challenges. Are there any big challenges, or what are the big challenges that Irish dentists are facing at the moment? It, of course, doesn't have to be as big as a global pandemic, but are there any, for example, economic pressures or government policies which are creating issues or drives to take fluoride out the water or anything like that going on?
So I think as we were talking about the medical card system, trying to deliver high quality care in the medical card system is definitely a challenge. We have a school dental scheme whereby students in schools will see school dentists during school hours at different times in their primary school education. And essentially, that doesn't really happen in lots of parts of Ireland now.
Okay.
So that's a challenge. Again, if you have the resources to fund private care for your child yourself, you're very lucky and you will receive adequate dental care. But if you're someone who doesn't have the resources and has a high sugar diet, that can lead to a lot of problems later on. So certainly, I think that's an area in Ireland that we need to look into in a big way, is ensuring that services for our children in Ireland are adequately resourced. And I think as well, running a practice, the cost of running a practice is high in Ireland. Again, I'd imagine it's similar in Australia, but it's a big barrier for people who want to acquire a practice, is that the cost of purchasing the practice and running it is high. And we have to obviously keep our prices competitive, and we have to earn a living, we have to pay our taxes, and we have to pay our bills and our staff costs. So I think that's hard for dental practices. There's no grants or anything like that available. So more or less 100% of the revenue generated will go back into the practice and developing the practice and compliance and our salaries, etc. So I think they're big issues in terms of what dentists, the challenges dentists are facing in Ireland at the moment. And then we have the issues that we all, I guess, can have in dentistry, that we often worry as dentists, as a fear of litigation, isn't there? And I'm sure you see that from dental protection's point of view. There's dentists who burn out and who really get stressed over
Yeah.
dental complaints and issues, which I am very empathetic towards those dentists. But again, I think those issues probably happen across the globe.
Yeah, I'm going to share with you. We were just talking about the cost of running a practice. So when I left the UK in 2003 and I came to Australia, I was on 50% as an associate in the UK. And I came to Australia and it was 40%. And I was really affronted. I was like, oh my goodness, they're like discriminating against me because I'm foreign. I didn't realize that 40% was standard issue in Australia. And just with all the discrepancy, because of course the price of dentistry is increasing beyond the price at which we can pass on to our patients, right? So a quite affluent or eminent orthodontist posted a blog essentially saying that we needed to have a circuit breaker and we could start off by cutting the associates' fees down to 25%. And I think you can probably imagine lead
Yeah,
balloon
yeah,
falling.
yeah, yeah,
But all joking aside, it's something has got to give. And I do think that because something quite dramatic is going to happen. I just don't know what it is. But I think that something's definitely coming round the
yeah,
corner. That's for sure.
yeah.
So you've mentioned difficulties for access, difficulties for children. Do you think it's just a resource demand mismatch, or do you think there's something else that could be done to help? So, for example, the Australian colleague that I interviewed for this, a lovely lady called Stevie Dilly, works for the Flying Doctors. And one way that we've, in Australia, are managing some of our communities who aren't getting access to care is getting the care to them. And it's quite the process, but it seems to be working. And you know how vast Australia is. So it's not like they can just hop in a car and drive to us. They are a long, long way away. Do you have services like that? Do you think they would help? Or do you think it's just more dentists need to be involved in that system and that's all it would take?
Well, I do. First of all, we have a shortage of dentists in Ireland, especially
Do
in
you?
especially in rural communities. In Ireland, we've two dental schools, one in Cork and one in Dublin, and we've a new dental school that's opened only a few months ago in Dublin, and we've about
Okay.
50 to 60 students in each year, and about half those students are from Canada or Asia.
Yeah. And you've got no guarantee they're going to stay.
So they can't, because they can't get work permits to stay.
Oh,
So
gosh.
unless they work in a hospital, they will have to return to their native country. So it means that we have a shortfall every year of dentists qualifying. And we do have lots of dentists who are coming in from countries like Spain at the moment into Ireland, who are very welcome in Ireland, and are doing a great job. But again, lots of dentists gravitate towards the city centres, and they mightn't
Of
really
course.
choose to work in rural practices. I think there's lots that can be done to incentivize and motivate dentists to work in more rural environments, especially grants or, and I think even for a new dentist coming to Ireland, I think actually working in a rural community would be invaluable, because you get great experience, great mentorship from colleagues, mentorship that you may not get in a city centre corporate style practice. So I think there's a lot that could be said for it, but certainly motivating dentists to work in these rural communities would really help and incentivize them. And again, resourcing them properly, having proper healthcare facilities so dentists would enjoy working in those spaces, and really modern high-tech surgeries, because within Ireland, especially again after COVID, lots of people now work from home, and a lot of our rural towns and villages are actually very populated now, way more so than 7, 8 years ago, because of the ability to work from home and hybrid working environments. So definitely bringing dentists into these rural communities will certainly help the workload of the current dentists, and also help access to care for patients in these areas.
Okay. So I'm curious, as you will probably remember, you would have had reciprocity when you came over to Australia, so you didn't need to sit exams.
Yes.
But many people, practitioners who come to Australia, have to clear an exam called the ADC, the Australian Dental Council exam, in order to practice. What are the requirements for Ireland? Do they have an exam, or is it just there are certain countries who you have a like for like arrangement with?
So we have the certain countries. So Australia, New Zealand, UK, and Canada are countries where their degrees are recognised in Ireland, and also any countries in the EU. Any country in the European Union, yeah. So, but if you are someone from outside these countries, you have to do entrance exams. So there's two exams. One is a written clinical exam, and the second is a kind of IVA, OSCE type exam. They're quite similar to the final year exams that the dental students do in Ireland. So difficult exams. Lots of people don't pass them. But if you really want to work in Ireland and you're from a country outside the EU or Australia, Canada, and New Zealand, that's really the only way you can work in Ireland. But actually, interestingly, it's hard for us to staff our practices at the moment with dental nurses and receptionists. And the last 3 or 4 dental nurses I've had have all been dentists or hygienists who are working in Ireland from different countries whose degrees aren't recognised. And I think it's quite interesting. And I had a lovely nurse recently from India who was trying to do her entrance exams and didn't manage to pass them. But she had never treated a patient because she qualified over COVID. So she'd never
Yeah.
actually put her hand in a patient's mouth. And I had said to her, I don't know, because we don't have any training scheme for junior dentists. I had said to her, I don't know if it would be a good idea for her to start working in a busy private practice. She'd probably be better off working in somewhere under supervision, and really starting off from the bottom up. So I think there's a reason why we have these entrance exams. It is important to ensure that the standards are kept very high. And I think that new dentists coming into Ireland, especially junior dentists, have to be very mindful of the practice they're going to join. Are they going to get the mentorship they need? Are they going to get the support they need? And if not, how are they going to get it?
Yeah, those poor COVID graduates, honestly,
Yeah.
they had a really tough time, I think. And, we were talking about at the start about how we had to do a certain number of extractions and fillings and make a certain number of dentures to be permitted to sit finals. Some of the COVID practitioners, as you're saying, were so restricted in the number of patients they could treat, or they didn't get to treat certain type of patients, like they never treated a child. I found that to be quite a common thing, that recent graduates over the COVID years say is they never treated a child. And of course, as you and I both know, that requires a completely different skill set.
Yes.
Um, Although it's still the brown stuff, it's just behaves slightly differently, doesn't it?
Yes.
Interesting times. So I'm curious, continuing professional development for dental practitioners in Ireland. In Australia, we have 60 hours over 3 years. We don't particularly have any core competencies, though there is an expectation you'll do CPR, infection control, things like that. You're supposed to do stuff that's kind of relevant to your practice. There's an expectation that recent graduates will do a lot more hands-on. There's an expectation that if you're going to bring something new in, like aligners, you're going to do some CPD. You're not just going to crack on and see how that goes. What are the rules around it in Ireland?
Would you believe, Annalene, that CPD was not mandatory in Ireland up to a couple of weeks ago?
Really? What a timely question.
Yeah, well,
So, what
literally,
changed?
it's literally just got passed literally in the last couple of weeks. So
Mad.
they've amended their dental act. The government amended the dental act to ensure now that CPD is mandatory from now on. But it's very new to Ireland. But up to now, we all do CPD. It just wasn't
Of course.
mandatory. So, so we all go in the courses. In Ireland, we have lots of different course providers. Because in Ireland we're so close to the UK and to mainland Europe, we would often travel to places like London, Birmingham, Manchester for courses. I went to Geneva recently to do a fantastic course with a guy called
Wonderful.
Pascal Magnier. It was amazing. It's only a 2-hour flight, so we have easy access to a lot of, yeah, I know for
You
Australia.
even get to Cairns in 2 hours and it's in the same state.
That's it. Everything is so close. Everything is so close in Ireland, so you can kind of go where you want to go in Europe, really, in a few hours generally. But CPD really is genuinely only become mandatory in the last couple of weeks. So we're still kind of thrashing out what the rules would be around it. I'd imagine it'll be similar to the UK or Australia. So,
I would
I
expect.
mean, we do, yeah. So but again, it'll be probably a self-assessment. I mean, we do have webinars for the group I work for. I run the whole education program. We have monthly webinars. We have 2 hands-on events a year. Our Irish Dental Association runs a conference every year where you can get all your CPD points. Dental Protection run lots of different events for us.
Sure do.
So it is easy to access. Obviously easy, but it's not too hard to access CPD. But I would imagine in the next year or two, it'll be, a new thing in Ireland. It'll be a new challenge to ensure that all our dentists can access CPD. But I do like the online CPD platforms. You have Ripe Global in Australia, which I think is
That's
excellent.
fantastic. Right Global's fantastic.
Yeah,
And you were saying about your young girl who hadn't done any treatment. One thing that they do with Ripe Global, which I think is absolutely wonderful, is you can do a hands-on course. So you essentially pay an amount of money and you get a phantom head and all your kit. And say you're doing crowns, you do crown preps. And I think, I don't know if you do it in real time or if you send them photos or videos and you get feedback. And I just think not only is that amazing for recent graduates who are trying to build their skills, but I don't know about you, when I came back from maternity leave, I felt I'd been on long enough, but you sort of sit there and it's much worse than when you come back off holiday when you're thinking, "Oh, yes." So I
yeah.
think there's a real place for that. And it's in that safe environment, real-time feedback. It was genius, really, to be
Yeah, well,
honest.
it's amazing. And I've looked into that course you're talking about because we have a couple of dentists in the group who need more mentorship. And they do offer a service, as far as I know, where you can pay for a mentor, which I think is great because some dentists might be a little bit shy or, uncomfortable reaching out to find a mentor. But being able to pay for a mentorship, I think is genius as well. I think it's an amazing idea. I'd imagine the online CBD platforms will really take off more so even in the next few years, especially in Ireland and the UK probably. But I think that's probably the future of dentistry, isn't it? And CPD is online education.
I think so. And there's benefits and disadvantages because, of course, it's great to be able to learn your way, fit it around. There's nothing better than watching a webinar in your yoga pants with a glass of wine. Like, I'm all for that. But if you haven't got a community like the one you're discussing in Ireland, where you are so close knit, dentistry is known for being quite isolating. And I think that kind of in-person CPD does sometimes, force isn't the right word, but people who wouldn't normally have that opportunity because they are quite isolated actually do get to be with their peers. I think there's advantages to that too, but
That's
it's
true.
hard, isn't it? We'll never get it right, I don't think.
No.
So I'm so glad that you love being a dentist. I love being a dentist. Dentistry's always been very kind to me. We've had our moments, I'm not going to lie. but she's always been kind to me. What do you love most about being a dentist in Ireland?
Well, first of all, I love Ireland, as you can probably tell. As we say in Ireland, it'd be even better if we could put a roof on it, because we definitely have, like you guys in Brisbane, we definitely get the rain.
Oh, we do. It's why it's so
Yeah,
green.
so green, so green. Let's console ourselves with that. But dentistry for me has given me so many opportunities in life. To me, it's been a wonderful career so far. It's been good to me. I've earned a good living. I've made loads of friends through it. I get to help others. I get to make, great connections with patients on a day-to-day basis. I wake up every morning and think, I can't believe I get to do this stuff today. I just find it so fun and so creative. I enjoy the complex cases, but I pick my battles. I would say over the years I've taken on more complicated stuff as I've evolved as a dentist. But I am far more I spend a lot more time now in the treatment planning phase. And again, I've learned that through working with colleagues. I've learned
Yeah.
that by planning things properly, you get far more predictable outcomes. But I enjoy the constant learning process of dentistry. It's never stagnant, it's never static. You never quite know where you're going to get in a day.
No,
You
you
have to be,
don't.
you're kept on your toes, but you really can make a difference to people's lives, which is really rewarding, actually. And, you can't beat someone coming in with a big problem and really transforming their smile and essentially often transforming their lives because of it. So I think that's something that stays with me. When I leave work in a day, I know that I've made a difference, and I know I've earned a living, and I can afford that handbag I want to buy at the weekend.
No, that's fantastic. And I agree with you. The basic relief of pain, we tend to underestimate as dentists how life changing taking someone's pain away is.
Yes.
And just even that, it's such a gift to be able to help someone in that way, meaningfully help someone in that way. We are very, very, very lucky. And I think being a dentist is fascinating because we're diagnosticians, proceduralists, radiologists, radiographers. We are, I don't know, counselors and confidants, and we get to be so many things all at once. And as you mentioned, when you build a good relationship with your patients, and it's really rewarding. So, what advice would you give to an overseas trained dentist who's listening right now and they're thinking, I quite like the sound of Ireland and I'm applicable because of where my degree is from or which country I'm from. What advice would you give to that person about coming and practicing in Ireland?
So first of all, I'd say to visit the country, bring your raincoat, bring your umbrella. What is it? And see if you like it. See if you like it. See if you like the people. See if you like the area. And if you're happy with all that, your next step really would be to register with our Irish Dental Council. If English is not your first language, you have to do an English competency exam to ensure that you have the English needed to work in Ireland. The registration process involves a bit of paperwork, which I guess is understandable, but getting through the paperwork and registering will be step number one with the Dental Council. Your next step is getting a job. And again, Ireland is small and there's a lot of who you know. So I would say to reach out to people on social media or through Facebook forums who are currently working in Ireland and get the lay of the land and get a sense of where you'd like to work, what kind of practice you'd like to work in, and get to know people like that. Then I would say to come over and visit practices and see again the areas you'd like to live in and apply for your jobs. And we have lots of jobs in Ireland because, again, we have a shortage. So if you're willing to travel and if you're willing to work in a smaller community, I would recommend that for a new dentist, because I think you would get the support and mentorship you would really need to work in a new country and to get the lay of the land. And saying that a corporate model might be good also, but again, it depends on the stage you're at in your career. I think. I think
Yeah.
if you're only 1 or 2 years out of college, you probably need someone who can give you help on a day-to-day basis. Whereas in a corporate model, you might find yourself working in a practice with lots of dentists your age or of the same skill level. So I think you have to be very mindful of that.
Yeah, no, that's really helpful advice. Thank you. And what about our either aspiring dentists or recent graduates? What advice would you give them? Doesn't have to be about practicing in Ireland, just life advice.
Life advice, I would say what's very, very important for us dentists is to manage our mental and physical health, number one. Really, I think it's very, very, very important. And I think as dentists, we can ruminate a lot and we can worry. And sometimes the problems snowball. A small problem might become a big problem because we're not talking to anybody about it. And it's very personal. If something doesn't work out or we have an adverse outcome, it can be very personal and it can really have a detrimental effect to our confidence levels. So I really feel that taking breaks, taking holidays, taking a good lunch break, getting out into nature, going for walks is key. I know I find at lunchtime I'm really boundary with my time, very boundary. So I'm really careful to make sure that I always get a good lunch break. I always go outside. I don't listen to any music. I just take time in solitude to process the morning and to prepare for the afternoon. And I really think that's very, very beneficial. And I think our physical health, making sure our posture is good, making sure we do our Pilates, regular exercise, it's not sustainable otherwise. And lots of dentists have physical issues, back problems, etc., from the way we have to sit and stand in dentistry. And I think I learned that early on, that really
Mm.
mental and physical health is really paramount for us dentists. I also think having friends in the profession is great, having mentors, having someone who you can go to with a problem. I think that's how I've learned over the years how to do things better. And I'll often, literally every day, I'll go to a colleague and say, look, I'm looking at doing this case with this patient. What do you think? I'll show them photos, study models, scans, whatever. And they might say, look, that's perfect. Everything you're doing there is fine. Or they might say, hang on, why don't you try this instead? Or what about that cluesal issue there? Why don't you take a look at that again? And actually, that to me is the difference between getting an amazing result and an absolutely exceptional result for a patient. So I think that's really key. But I say to young dentists to take your time, do your work well the first
Sure.
time. Don't rush it, because you'll be doing it twice for free. So take your time doing it. If it takes you an hour and a half to do a filling really well under rubber dam or whatever, as the best filling possible, go for it. So be it. And over time you'll speed up, but do it right the first time. I would say communicate really well with your patients. Make sure they're very informed, and not to get too hung up on consent forms and this kind of thing, because I sometimes think that that can be an issue. And I think especially with ChatGPT and AI, it's so easy now to ream off pages of consent forms that are shoved in front of patients and they don't have the time to read them and understand them. So I do really feel that communicating well is also extremely important. And if something does go wrong, at least you discussed everything and the pros and cons with your patient in advance, and they'll have that understanding before you start anything. And I think treatment planning is a massive, very, very important part of dentistry. And I really need to spend the time treatment planning. And it mightn't be the most lucrative thing we do in our working day, but I see it like, going into a shop and trying on clothes, that when you're the shop owner, you don't generate revenue from that person walking in the door, trying on clothes and heading off and not buying. But at least that person's had the ability to try on the clothes. So I feel it's the same in dentistry. I'll often do treatment planning appointments where I'm not generating revenue from that appointment, but I know the patient understands what we're trying to do. I've gone through everything in great detail, and the patient understands all the steps involved. So I really feel that when I tackle a complicated case, I've done all those steps first, and I'm going to get a predictable outcome because I've done all those steps. But it takes time. And I think if you want to do those cases, which lots of younger dentists especially want to tackle, you have to make sure that you have the help and support you need. Because really you want to take baby steps in the direction you want to go in, as opposed to giant leaps. And I think enjoy your dentistry. You can diversify your skill set. You don't have to stagnate. If you find that you're not loving root canals anymore, you can look into different areas of dentistry if you want to. You don't have to stay put. And I think it's a great profession. And I think we really need to keep learning, keep interested in it, and keep evolving as a profession. And I think if you do those things, you'll always enjoy it. You'll always enjoy it.
No, I think that's all really, really valuable. And I absolutely agree with everything that you said. And I always find the treatment planning an interesting one because sometimes people are upset when a patient then doesn't come back from the treatment. But I always think that's a little bit of a gift because I guarantee you, you've just avoided a complaint, my friend. Ask me how I know, says the dental protection lady. Ask me how I know.
We've all been there. We've all been there. And often when you're very young and early in your career, you don't see the red flags. And as when you're older, you know the red flags. You can see them coming. You can see that those bright red lights coming in your direction and you know what to do. But sometimes when you don't have that experience, you're not really sure. And that's when your more senior colleagues might come into action here and say, well, hang on, maybe you should refer that case to somebody else because maybe it's a bit too advanced for your stage. So I think we shouldn't be ashamed of ourselves when we are,
No, not at
young
all.
in our career. We're all learning. And when we know better, we do better. And it's like anything, we're going to improve over time with practice and experience. And we're not going to know it all in year one. In
Nor
year
should
22,
we.
I'm still learning every day.
No, that's right. That's really sage advice. Thank you so much. I really appreciate you giving up some time for us. And of course, thank you all for listening. If you like dental protection podcasts and you'd like to hear more, please subscribe and leave a review.